And good afternoon, everyone. My name is Nick Staub, Arizona Department of Services. I am the Medical Director for the Bureau of Epidemiology and Disease Control. And along with my colleague, Stephanie Martinez, will be presenting today on safely returning to in-person instruction. So Stephanie, I can allow you just to introduce yourself briefly to the crowd.
Sure. Hi, everybody. I'm Stephanie Martinez. I'm the Office Chief for the Office of Community Innovations within the Department of Health Services. Happy to be here today.
Great. Thank you, Stephanie. So a couple of housekeeping items. First of all, I would like to thank the Arizona Department of Education, who is co-hosting this with us today. A number of them are on the panel with Stephanie and I, and will be available to help answer any questions that may come up as the discussion goes on. If you have any questions, I would ask that you add those questions to the chat box, and we will have some members of the panel monitoring that chat box and can use those as questions to answer at the end of the presentation. Just a few comments or a few remarks to start off. I would like to thank everyone here who's joining us today. It looks like so far we have over 700 attendees this afternoon. Having been involved with the Department of Education on the roadmap for reopening schools and just preparing for the school year ahead, we are all well aware of all the work that has been done and continues to be done out in the community to plan for the school year ahead and how that will look different and how it will be a success. And we are happy to provide this additional guidance to you as you make that decision as to when it is safe for you to open your schools. We understand that this is not an easy decision. There are a lot of moving pieces. And again, happy to provide this additional guidance for you, hopefully to make that decision easier. So what I plan to present here in the next 20 minutes or so is the guidance that was released yesterday from the Arizona Department of Health Services. Kind of give you guys a better understanding of what that guidance is, what the benchmarks are, and where you can access them. And then Stephanie will give you a little bit more, a better sense of what has been released in terms of additional guidance and tools for you all. So again, no one on this call needs to be reminded that there was an early closure of schools during the last school year due to the COVID-19 pandemic. In June, the Arizona Department of Education released the roadmap for reopening schools. And much of what our benchmarks here have tried to do is to add more context to that roadmap so that you won't be introduced anything new here, but just, again, given additional context to understand that roadmap and to put your plans into place as you've been planning. Recently, the governor released Executive Order 2020-51, Arizona Open for Learning. And in that executive order, the Department of Health Services was tasked with developing benchmarks for the safe return of in-person teacher-led classroom instruction by today, August 7th. And again, those benchmarks were released to the public first yesterday afternoon. Each school district and charter school is then to consider these recommendations as guidance and additionally guidance from county health departments, as well as any community needs and resources specific to your schools as you decide to safely open teacher-led classroom instruction. So additionally, yesterday when the benchmarks were released, a guide called Safely Returning to In-Person Instruction was also released, and we will provide access to that if you've not already found it. But essentially, safely returning to in-person instruction really notes that there are two critical pieces to safely reopening schools, and it's essentially a how and a when. And the how is what many of you have already been doing, and that's developing mitigation plans based on the roadmap for reopening schools that aim to reduce the spread of COVID-19 among students and staff within the school setting. Those plans must be implemented prior to resuming person instruction. And so that really has been out there for a while. We are adding here is the when. And the when is really when the level community spread safe enough for you to implement your mitigation plans to start person instruction. So in our, we really see how and the when is really important in determining when it is safe to reopen school for in-person instruction. And again, these benchmarks seek to qualify the level of community spread in order to help you make that decision at your local school level. So again, the Arizona Department of Education has partnered with a broad variety of individuals in the community to develop the roadmap for reopening schools. At the Arizona Department of Health Services, we're very happy to assist in developing that roadmap. And essentially, as part of that roadmap, there are 3 levels of community spread that are described, and they are minimal, moderate, and substantial. And so along with those come definitions that kind of vaguely describe what that spread is. And again, these benchmarks that were released yesterday seek to put more context and meaning to those levels of spread by adding certain elements that can be tracked as the COVID-19 pandemic progresses. So briefly, the benchmarks relate to cases of COVID-19, the percent positivity of tests for COVID-19, and COVID-like illness. And so in the coming slides, I will go over those in more detail. But then for each of those benchmarks, there are assigned values to fit into the different levels of community spread, those levels being minimal, moderate, and substantial. And then those levels of community spread have been tied to different models of instruction that relate to the map for reopening schools. So again, we have these benchmarks help a little better context around community spread so that you apply it with your community and make those decisions when it is safe to go with those different models of instruction. So for cases of COVID-19, there are 2 different ways that we are looking at this benchmark. And one is by a case rate, or that's the number of cases per number of population. So here for a case rate, we're looking at the benchmark would be 2 weeks below 100 cases per 100,000 population. And so that would be reported by a curve similar to the one you see here in red. Similarly, the case count can also be seen as a decline in weekly average cases for 2 consecutive weeks, not including the current week. So when we are collecting our data, it usually takes about 1 week for us to get a reliable count. And that's related to reporting, a lag in reporting from labs, as well as the turnaround time that it takes labs to go from the time that a specimen is collected for an individual to when that test result is available. So cases can be seen in each of these fashions. The data is reported to the Arizona Department of Health Services through our electronic lab reporting, as well as a minority of cases that are reported by fax and by mail report. This data will be available based on a county level as well as statewide. The next benchmark is percent positivity. So percent positivity is looking at the number of tests that are performed in any given week, and we're looking at what percent of those tests have positive results. So the benchmark for percent positivity is 2 weeks with a percent positivity below 7%. And in the coming slides, I'll kind of explain this a little bit better because there's a range that fits minimal, moderate, and substantial. For reopening schools, for this initial reopening, we're looking for 2 weeks with a percent positivity below 7%. Moving forward, for that moderate level of community spread, that the range would be 5 to 10%. But again, for initial opening of schools, we're looking for a percent positivity to be 2 weeks below 7%. And again, the data for percent positivity is reported to ADHS through electronic lab reporting, and this data will be available at the county level. The next benchmark is COVID-like illness. COVID-like illness is part of our syndrome surveillance program. The syndrome surveillance takes information that is gathered from hospital partners across state. Not every hospital, but those that are enrolled in the SMART surveillance form report data that is then evaluated to fit a certain set of criteria where the present illness looks like that. So again, that's why we call it syndrome surveillance. These are not necessarily testing results, but other data elements are extracted from medical records to show that a person is presenting for symptoms that are consistent with COVID-like illness. For COVID-like illness and syndromic surveillance, this data is available, again, because it's not from every hospital, it's available by BioSense region. So again, BioSense is our syndromic surveillance platform, and that's reported by region. Those regions are Northern, Central, Southeastern, and Western. So in this slide, you will see the 3 benchmarks present together, and this is how it will be presented, how it is presented in the document that is associated with the benchmark. So again, there are a few additional considerations for offering in-person instruction that go along with these benchmarks. So again, for cases, we are looking for either a 2-week decline in the number of cases or 2 weeks with a new case rate below 100 per 100,000. So either of those 2 categories would meet the benchmark for the county. For percent positivity, we're recommending 2 weeks with less than 7% positivity, although the moderate range is 5 to 10%. And then for COVID-like illness, syndromic surveillance, we're looking for 2 weeks with hospital visits due to COVID-like illness below 10%. Furthermore, we understand that each community and each school and school district may have other factors that affect these benchmarks and give fair amount of latitude to local health departments to help schools and school districts understand how those benchmarks apply to their community. So there may be specific situations in which a benchmark may need to be modified for that school or for that community, and your local health department has the authority and has the knowledge in order to help you place those benchmarks within the context of your community if there are altering situations. So again, as I mentioned previously, the levels of community spread do relate to instructional delivery models. Those being traditional, where all students are in physical buildings, much as school was before COVID-19. A hybrid model where some students are in physical buildings and some students are in distance learning. And then a virtual model where all students are in distance learning with on-site support services being offered in school buildings. And so this chart here just puts down puts into different categories what some of those mitigation efforts would be provided at each delivery model level. Again, this once again shows the three scenarios, the three models of learning associated with the three levels of community spread, and the knowledge that as this pandemic goes forward, our current goal is to go from substantial to moderate so that we can open up hybrid learning. But there's an understanding that as this pandemic goes forward, there's the possibility that once again, schools may have to go from a hybrid to a virtual model, as well as eventually, hopefully, we get from moderate to minimal community transmission, and we can start relieving or kind of pulling back some of those mitigation techniques that have been put in place to control transmission within our schools. Also, with the document that's released with the benchmarks is an initial reopening checklist. This just goes over some of the things we've already talked about. But again, do you have the plan in place for the mitigation efforts? Locally, are you meeting the benchmark criteria? And then, you know, have you done what the other things that have been asked of by the Department of Education to get your schools ready to open? All right, so I'd like to talk a little bit more about using the data dashboard, and if I can figure out how to use my computer, I will walk you through that. One thing to note is kind of the calendar of how the dashboard works. So the dashboard will be updated on a weekly basis on Thursdays. So when you look at that update on Thursday, the first of which was posted yesterday on August 6th, again, we are not looking at the last week prior, because again, that week is used to compile data and make sure that we have all the data in place in order to report accurate data. So you're looking back, you ignore the past week, and then you're looking at the 2 weeks prior to that. So for the update on August 6th, you would be evaluating the weeks of July 12th through the 18th, and also July 19th through July 25th. And again, this slide just kind of marches out through the next couple of weeks of updates, showing which weeks would be included in that dashboard. Obviously, this will continue past the weeks indicated here, but this is just intended as an example to help you understand what data from what weeks is being reported. And then this is an example of the dashboard that is currently available on the ADHS website. It is on the main school landing page, and like I said, I will attempt here in a moment to show you all how to get to that page. On the dashboard, if you hover over the counties on the map here and select a county, it will give you specific data for that county. And then on the right is each of the three benchmarks labeled 1, 2, and 3. Number 1 being the cases, number 2 being the % positivity, and number 3 being the syndromic surveillance for COVID-like illness. And it will also demonstrate the 2 weeks that are being reported and where they fall, whether or not the benchmark is being met, either with a clear green check mark or a red X. Also, here is the benchmark kind of goal, 7% for % positivity and 10% for COVID-like illness. Additionally, in the document are additional guidance for responding to COVID-19 in schools. That includes what to do when someone on site has COVID-19 symptoms, either a staff member or a student, how to get them into appropriate isolation and separated from other members of the school. Additionally, there is some guidance on quarantining classes or closing school buildings. Again, the decision to quarantine a whole classroom or to close a school building will be in guidance or with guidance from your local health department. Each health department may have individual guidance on how they would like cases reported, and I recommend that you review those reporting requirements for your local health department, either on their website or in contact with the local health department. Before I move on to Stephanie, who's going to share a couple of other resources that we have released with the document, I am going to try and walk you all through how to find the website. So, can somebody just tell me if they can see my web browser here?
We can.
Excellent, thank you. So this is the main landing page for the Arizona Department of Health Services. If you type avdhs.gov into your web browser, it will take you here. There's a large COVID-19 banner at the top of the web page. And from there, you would just click on General Info about COVID-19. This will take you to the COVID-19 webpage. On the left is a menu, and you're just looking for schools, childcare and K-12, and universities. And if you click on schools, it will take you to the main landing page for schools. Here, you just scroll down, and after the call-out box will be the dashboard. So again, initially it will show you data for the entire state, but if you click on, or if you just scroll over the state, you can select your county. You will notice that when you are hovering over a county, a region will be shaded, and that corresponds with the region that is reported together in the syndromic surveillance. So all of the counties in that shaded area will have the same data for the syndromic surveillance, or benchmark number 3, the COVID-like illness. And again, if you click on any individual county, it will give you the specifics for that county. All right. Now I will just go back to the presentation. And at this time, I will pass the presentation over to Stephanie to describe the supplemental materials that are available to you all now. Are you available, Stephanie?
Sorry, I was still muted. Okay, bud. Thank you. Thank you, everybody. I'm sorry, my second grader is navigating virtual learning right now, and his class is starting, so his alarm is going off. I'm going to walk you through some supplemental materials that were developed. We recognize and understand that some additional communication will need to take place between schools and families, or between district or school administrators and the teachers and staff, and so we hope that these resources are helpful. I also want to encourage you to connect with your local health department as well. Many of them are also developing some materials that might help with that communication piece. So I think that partnership is going to be really, really important going forward. Can you go to the next slide, Nick? Thank you. So the first one we have here is a simple graphic that's just going to explain the do's and don'ts of how to wear a mask safely and how to handle it safely. Cloth face coverings are required for students and staff in executive order. And so this will be an important piece for students to understand when they do return to either hybrid or traditional learning, how to put it on, how to take it off safely, and how to store it when it's not being worn. You can go to the next one too. We do have many resources available for hand hygiene, right? This is not something that is new to schools or new to anybody really. Hand hygiene is really important for any type of reducing of virus spread. So what we do like about this one though is it does show how doctors and nurses, so like the most effective way that individuals can wash their hands. It does show each of those steps along the way. So this will be a helpful handout to display near hand washing stations, or even to email out to your families so that they make sure they're washing their hands effectively at home as well. This next document highlights the symptoms that people should be watching for at home. And when we get to the sort of like screening that we hope to see taking place within the school environment, and this is directly from ADE's Roadmap for Reopening Schools, one of the most important parts is the screening that takes place at home. It's really, really important that if students or staff are feeling sick, that they stay home when they don't feel good, right? We don't want to send a child who has any of these symptoms perhaps on a school bus, which might then expose additional students within the school environment. So this handout does pull out some of the more common ones, particularly that we will see in children. And so this might be a helpful handout to share with your families as well. The concept of physical distancing can be difficult, particularly for younger children, to understand what 6 feet might be. Nick, I need you to go back one. Thank you. So we did pull out a couple examples that kids might be familiar with seeing to help them understand what 6 feet could look like. So we do have a bed here, as well as 7.5 basketballs. So that one's probably a little bit more abstract, particularly for our younger kids, but it's a little bit of a fun way to talk about it. Again, this is something that could be shared with families or displayed around your school campuses. So one of the things that I've picked up on as a parent is the conversation taking place around how we just can't wait until we can go back to school and things are normal. And even when we do get back into school buildings for in-person instruction, things are going to look different. And this graphic right here can be a way to help communicate that to families. These are a sprinkling of mitigation strategies that we pulled from the ADE Roadmap for Reopening Schools. And these are things that families might be experiencing when school buildings do reopen for in-person instruction, so that they can start either talking to their children about how things might be different, or just even understanding themselves, right? So this particular document will walk you through from the start of the day until a student returns home, and does address how things might be changed throughout the day. So, before you leave home, we want to make sure that we're checking for symptoms. At lockers, we might have staggered schedules so that people are less likely to congregate around spaces. There might be partitions in bathrooms so that students aren't side by side when they're washing hands or using bathroom stalls. So there's lots of ways that this can be implemented, and this is just meant to give some examples of what a day might look like. We also have a partnership with the Department of Administration to offer free masks. The masks could be ordered by parents for their children. In the toolkit, there's a little bit more information than what's on this slide. The masks are not recommended for younger children just because of the size, but they would work for like your middle school and high school kids. They also are available for staff or teachers that are within the school buildings. There's a link to the online form as well as a phone number so that families or staff could order those as needed. And then the last thing we have is this infographic, which was designed to help explain what the benchmarks look like and offer some additional explanation to the families, so that perhaps they have a better understanding of when schools would be able to return to in-person instruction. There's, in the supplemental handout near the end of the toolkit, there's also that continuum of learning document that Dr. Staub was showing earlier. That would be another great resource to help parents understand where things are going when we are in substantial spread to moderate and then back to mild. And I think at this point, we are going to address some questions that have appeared in the chat box.
All right, thank you, Stephanie, for that. Just going to pull up that chat box. So I know we have some panelists, some members from ADE. I don't know if there were any particular questions that you all saw that you wanted us to start with.
Hey, Dr. Staub, this is Richie Taylor from ADE. One of the questions we're getting is, can you explain why it's safe to provide the targeted on-site services, but traditional instruction is still not met within the metrics?
Sure. So the on-site services, and anyone from ADE is welcome to adjust this comment, but the on-site services, as I understand them, are for those students who otherwise could not access the virtual learning. So whether that's because they don't have the supervision at home, or they don't have access to the technology for a wide variety of reasons, they cannot access virtual learning. So the on-site resources are to assist those children who otherwise could not participate in virtual learning. On-site resources are not in-person instruction. So those individuals who are making use of the on-site resources are still participating in virtual instruction. So we see that as absolutely necessary, because otherwise those children would be unable to learn, and we know they need to get back to learning. So the difference is just a higher threshold for what needs to take and what needs to be done in order to provide on-site resources, as opposed to move to that next level and bring students back into the classroom for in-person instruction, which would begin a hybrid model, or moving to full in-person instruction in a traditional model. And I invite anyone from ADE to add a comment to that as well.
And we also have further guidance on the Department of Education's website on on-site services and how to prioritize and make that work. And we're also planning to do a webinar next week on that as well. And that information will be sent to our listservs on Monday.
And this is Stephanie. I just want to add, we did link to ADE's guidance for on-site instruction within the toolkit here. So those of you that have access to the link to the toolkit I put in the chat box earlier, you'll also find the link to the on-site guidance as well.
Hello, this is Whitney from ADE. I would just add on the on-site, because tracking some of these questions, the waiver for on-site support services is, as Dr. Staub mentioned, when there is a local outbreak as defined and determined by the county health department with DHS. And so on-site support services are required to begin August 17th, regardless of where we are in terms of these benchmarks.
And then if I can also just call, so I know Stephanie shared the link in the chat box, but also if you can still see my screen here, on the school's webpage, currently in the same call out box, is quickly returning to in-person instruction. If you click on that, you'll get to the document that you will find very similar to the slides that I presented today.
Dr. Staub, it sounded a little bit like you were snorkeling. So just in case that was for everybody, the link to the guide is in that second call out box on the school's homepage.
Another question we're getting is, will this data be available by zip code or anything further than the county level?
This is Dr. Stockton. I'm afraid that
I think we lost Dr. Staub's audio. So Dr. Staub, we can't hear you. I'm going to take a stab at answering the question, and then if I'm wrong, maybe we can correct me in the chat. The dashboard on the Department of Health Services website on the school page will be only at the county level. However, you can work with your local health department if there is an ability to go either to a zip code or a district level. That's who you would partner with to get that particular data. I do know that Maricopa County announced on Wednesday of this week that they are planning to release their own dashboard that I believe would go down to the zip code level. And so we may see something similar through our other local health departments as well.
Can you explain why 7% was chosen as the threshold for hybrid when other organizations have identified 5% as a threshold?
Yeah, can you all hear me now?
Yes.
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 Okay. So in terms of percent positivity, that level is, I understand, has been thrown out as 5%. Again, if you look at the coronavirus task force levels for minimal, moderate, and substantial spread, you will be looking at, and I can just scroll to it right here, you'll be looking at ranges of percent positivity that are greater than 10, 5 to 10, and less than 5%. We all agree that in order to go back to a full traditional model with all students expected to be in-person learning, that we would want that percent positivity to be less than 5%. However, for the hybrid model, where some students would be in-person learning and some students would be in virtual learning, and there would be some relative choice there as to which model the individual's in, we have chosen 7% as the midway of that scale. Moving forward, in order to move, if cases were increasing in the community and there was increasing community transmission, and we were seeing percent positivity to go up, we would recommend going from a hybrid to a full virtual instruction model when that percent positivity was greater than 10%. So again, we feel like at ADHS, the 7% in order to transition from virtual to a hybrid model is an appropriate level. I also would remind you that in Arizona, our percent positivity was as high as 21%. And so the relative improvement from 21% to 7% gives us a lot of confidence that the degree of transmission within the community has significantly improved, and that those mitigation efforts that have been put into place, both by county and city ordinance specifically for masking, really puts schools in a much better position to safely reopen.
Can we explain why the first benchmark has an either or, either the cases per 100,000 or a decline for 2 weeks, and what the thinking is behind those two different options for the first benchmark?
Sure. So as I said with percent positivity, you want to look both at an absolute case number as well as that trend towards an improvement. And so with the decline in weekly average cases for 2 consecutive weeks, we believe, and keep in mind that you also are not looking at that past week, so you're really looking back 21 days. And we feel like a significant improvement in the average cases over that time period indicates a decrease in community transmission, making it safe to open up schools for in-person instruction.
Can you clarify not including the current week and how the calendar works for the 2 weeks back?
Absolutely. So when I look back at the past 7 days, when I'm thinking of, so all of our data is based on lab reports that are received at ADHS. The most efficient way to get lab reports is electronically, as an electronic submission from the lab directly into our MedSys database. However, some labs are reported by alternative methods, including fax and mail. So depending on how those labs are reported, it just takes time to get them into the system. Likewise, the turnaround time from the date that a person is tested, from that specimen collection to when that result is available, is a variable amount of time. So, because of that, we exclude those 7 days to give that time for the data to catch up. And then the other question was about the calendar. Someone did a great job. I thought this was great, but I understand it's a little hard to understand. So again, when we update the dashboard on a weekly basis on Thursdays, so if you can see my cursor here on the screen, so August 6th was our first release of the dashboard. We eliminate the past week, which is 7 days, so that goes back to July 30th. And then what we are looking at are the 2 preceding weeks. So you're looking at the week from the 20th to the, from the 19th to the 25th, and from the 12th to the 18th. So again, this is just to ensure that those weeks that we're reporting, when we're looking at these 2-week intervals, we want to make sure that we're reporting on weeks that have accurate data, meaning we've received all the data that there is to receive from those weeks, and that you're looking at those full weeks. And then we chose Thursday as a data update because we know that if schools are putting in plans to resume some sort of in-person instruction, having that data on a Thursday, giving the weekend prior to a possible resumption of in-person instruction on a Monday. So that's why we chose Thursday as the day of the week to update the dashboard.
Are there any counties that currently meet all 3 metrics for safety?
Currently, there are no counties that meet all 3. For those that are meeting 2, it is the percent positivity that is still, we're still waiting for that percent positivity to come below 7% for 2 full weeks in all counties.
Are we seeing an improvement in the turnaround of test results and available testing data?
Yes. So one of our largest commercial laboratories had a significant delay in turnaround time in the last few weeks. And it was reported in the news that there is a significant backlog. That backlog has been caught up, and that lab partner has increased their capacity, and so turnaround times have significantly improved for community testing across the board.
Are school districts required to follow these metrics as they decide to reopen their schools?
No. So by executive order, these benchmarks are to be used as guidance for schools to decide when it is safe. They are not intended to be absolute, meaning you could not open until you meet these benchmarks.
And this one is probably more of a question for ADE staff. Can we clarify the difference between hybrid learning models and the on-site services?
Hi, Richie. This is Kate. I'll be happy to take that one. I'll start with on-site support services, and I just want to reiterate what Dr. Staub shared earlier in the Q&A, that the purpose for the on-site support services is to meet the needs of kids who need to be on site to receive services during virtual learning. So this is a time where services are being provided, but direct instruction is not happening. These students are receiving virtual instruction. However, they are receiving meal services, special ed services, English learner services, other support services that cannot be delivered virtually or for students who need a safe place to learn. And they're completing their actual learning in a virtual manner. The hybrid version means that students are returning to in-person instruction where actual teacher-led instruction is happening on site. It's different from full in-person in the sense that some students are still receiving their instruction from a virtual standpoint, and some students are in person. LEAs have different varieties of how that can be delivered. It could be delivered on an A-B schedule where on A day, the students come to campus. On B day, the same students are attending school virtually. So there are different versions of hybrid instruction, but the key difference between hybrid and on-site is that hybrid is providing in-person instruction and on-site is providing support services with instruction delivered virtually.
Thanks, Kate. Can districts or charters expect any support from the state or county health officials on contact tracing?
So case investigation and contact tracing will continue at the state and county levels and local health department levels. We do not expect schools to do contact tracing for cases that are at their school. Those cases should be reported to the health department, and contact tracing should resume from there. Schools have always played a very important role in investigating outbreaks of disease within their communities. This is certainly not the first infectious disease for local health departments to work in conjunction with local schools to do both investigations and provide information about who may have been exposed. So schools and the local health departments should continue to operate as they always have to investigate communicable disease in the community.
And it's recommended that when you're moving from one category to the other, from substantial to moderate to minimal, that you meet all three of those requirements to be in that category, right? So that if you are one in the red and two in the yellow, you would still not be cleared to open. You'd want to make sure you were hitting all of the benchmarks in each category. Is that correct?
Correct. Now, it is a little unfair when things are getting worse. So if you are in a hybrid learning model and then suddenly you have two benchmarks in substantial, we would recommend considering, again, these are considerations and not mandates, that you consider resuming virtual instruction. However, to go in the improving direction, so from a virtual to a hybrid to a traditional, then that is when we would expect those three, that all three of the benchmarks are in a minimal or moderate area, minimal or moderate degree of spread. Thank you.
What was the rationale for the metric for cases being 100,000 or 100K below 100? It says even at our peak, Arizona, we did not exceed 60 per 100,000. Can you explain a little more about that metric?
Sure. So again, when you're looking at community spread, when you're looking at transmission of any virus within a community, deciding on these metrics can be difficult because we don't know what the number of cases, we don't know how infectious a case is, and to be honest, we don't even know necessarily how many positive cases are being tested. So again, arriving on any of these metrics is difficult, and COVID-19 being a new infection, have a lot of precedent. So our decision on these metrics was based on the coronavirus task force and kind of on a larger body of evidence that really looks at the transmission of any respiratory virus. But again, it may not necessarily, it is difficult to take these metrics and apply them to both the state of Arizona and to smaller communities. There's no absolute definition there. So again, we are using these definitions as they've been prescribed and kind of directed on a broader basis. And again, they're based more so on a respiratory infection within the community than necessarily specifically for COVID-19, as we are still learning more about its specific transmission characteristics.
Thanks. Is it correct that data logging is the day that the test was taken or the day that it was reported? Just trying to understand what data is being reported and when.
Sure. So cases as well as the positivity rates are based on the date of collection. So that's the date that the specimen was collected from the patient. So I know there have been a lot of questions in the chat box, and I appreciate our partners from ADE monitoring that. We have recorded this webinar, and so we will make that recording available both on the ADHS website and then also on the ADE website, I'm assuming I can say. And so we will make sure that we communicate out where that recording is. Again, these infographics and these slides are all part of the safely returning to in-person instruction that can be found on the ADHS schools website. And so we invite you to go there, download it, make sure your schools and your LEAs are aware of its content. And then I am also aware that many of our local health departments will also be providing further instructions on both how to look at the dashboard, both at the state level and at the local level as well.
Thanks, Dr. Staub. I'll just add one more thing from ADE. All of this will also be on our website at azed.gov. And we will be sending out information for a webinar on on-site services on Monday. So look for that in your inboxes to happen next week.
Again, I would like to thank Stephanie Martinez for helping me present today, our partners at ADE, and all of you out there who are working to put this into real life and real plans. We will continue to support you in your efforts, and thank you for everything you're doing for Arizona schools. Thank you.